Tukimanyi bulungi nti Uganda yalumbibwa ekirwadde kya Ebola era nga Minister of Health ne World Health Organization basobola okuba nga ate bakakasa ensonga eno nti Ebola mu Uganda mwali. Naye obuzibu bwetusanze oba obuzibu Minister of Health bwesanze nti waliwo ba health workers abamu abasazeewo okuba nga ate beedima nga bagamba nti bagenda kuba nga ate bakwata ku mulwadde wa Ebola yenna mu ggwanga erya Uganda okutuusa nga basobola okuba nga ate babasasula arrears ze babanja eza COVID. Bagamba nti bakola omulimu munene mu COVID naye risk allowance waabwe Minister of Health yamwesigaliza era nga teyasobola kuba nga ate basasula ssente ezo. Minister of Health wansi wa Minister Ruth Aceng twayogeddeko naye n'atugamba nti abo tebalina kye batubanja okujjako twabasasula ssente zaabwe zonna. Minister agamba nti balina more than enough employees ba health workers okubanga ate batakolinga ekirwadde kya Ebola. So waliwo stand off wakati wa Minister of Health n'abakozi ba government naddala abasawo mu malwaliro. Katugulage emboozi eno then oluvannyuma tujja kuba tukwongera details endala.
Ssente za risk allowance owa COVID twagezaako ekisoboka kubanga okusookera ddala ministry yakansolinga contract zaffe ne batuwa salary yonna teri abanja salary naye za risk allowance ne zisigalayo ne bagamba bajja zituwa. Kyatuuka ekiseera ne batugamba tukole list ne tukompilinga list eyo era nga batuwadde ne draft kwe tulina okugoberera okukola ki okompilinga list ne tugikompilinga era nze kennyini ne ngitwala ku ministry naye nagezaako okuba nti ngoberera ssente ezo bazituwe ne director yennyini n'awandiika ki ebbaluwa ng'asaba ministry esasule abakozi risk allowance gwe baakolerera ne batusuubiza bajja tuwa ne paka kati tebazituwanga. Bw'ogendayo bakugamba nti gumiikirizaako ekiseera ne kiba nga kigenderedde paka kati tetukola ki tetuzifunanga.
Oluvano ne bakola batya?
Kakati obuzibu bwe bajjira bwe nagendayo ne baŋŋamba nti abo abali ku lisiti okwo basayininga okulaga nti be bannannyini ki mannya ago era basitaafu bonna ne basayininga. Bwe basayininga nenzirayo nti lisiti yiino ngikomezaawo basayinize ne bagamba nti agumiikiriza. Kati awo obuzibu bwe bwajjira nti bo basitaafu balowooza bwe baamala okusayininga netwala lisiti ne bampa ssente neŋŋaana okukola ki okubasasula. Kati nabo sayidi emu bagamba nalyaki ssente zaabwe naye nga amazima ssente tetukola ki tetuzifunanga.
Kino kikozera okuba nti basupportinga abantu baffe abali
mulaalo y'abakozi kati yakendeera eri wansi ne ku ssaawa eno tulina Ebola mu regioni yaffe naye bw'obagamba nti mujje tusupportinge oba tusavinge ki abalwadde ba Ebola bagamba nedda ministry tusasule ssente zaffe eza COVID zetubanja tulyoka ate tukole ki tutandike okukola ki okujjanjaba abalwadde baki ab'Ebola. Ku ssaawa eno abali ku tiimu bantu bapya abasinga ba interns be baliko bannaasi be baliko okusinga naye ng'ate abo si be bana abakola muki mu COVID.
Kino magega
kakati tulina tiimu waaka yekola abalaabu bakola bannaasi bakola bakiriina bakola ne baddokita mwebali naye nga bw'otunuulira abo bonna baddokita bokka be bakulina ki oath egamba nti patients what first priority. Era ffe nga baddokita ne ku ssaawa eno mbadde naakava muki mu ETU okwekebejja omulwadde waki owa Ebola. Tusooka ki balwadde ne tulyoka tuzaako ki ne kakati kaadaazi ezisigadde ekyo bw'okibagamba nedda twakola twawaayo obulamu bwaffe twarisikinga obulamu era abamu baafa kakati fe abaawonawo lwaki tebatuwaaki sente zaffe ani bagamba leka tukole ki katujjanjabe ebirala kasita nabali balwadde bano tukole ki tubalekere abanaabajjanjaba abalala.
In the Bale region, there is a concern that some of the health workers have raised a concern about, have expressed dissatisfaction and unwillingness to participate in the fight based on the previous experience where their risk allowance for COVID were not provided.
Really?
And yes, for Bale Regional Referral Hospital. Yeah, and this has actually affected even the response at the casualty ward.
I was in Bale yesterday, and the number of health workers coming up to attend to patients is enormous. I personally interacted with them and prayed for them. So I have not heard about that rumor. You are the only one.
Maybe they have feared to tell you.
Anyway, all those who worked in the COVID response were paid. All. Some were paid a little later because that is when the resources came. But all were paid. There is no one who was not paid. All of 2022 were paid. And right now, as we are speaking, the isolation facility in Mbale has adequate health workers, and more are still coming.
That's all. For the rest, you made it here in your speech.
Yes. Okay, so what questions do you have?
The Minister of Health stopped our what? Contract. And they said, we don't have what? Money right now, and the contract was cancelled. So after cancelling the contract, we were given our salary. But we were still demanding the risk allowances. It was for 5 good months. So that allowance, they told us that please compile a report or a list for the people who were not done what? Who didn't receive the allowance. So I compiled that what? That list, and I submitted it to the what? To the Ministry of Health. I was following it up. Every 3 to 2 weeks I could go to the ministry asking. They were telling me it's not yet done what? Approved. You wait. Not until I gave up. And even the director himself tried to write to the what? To the ministry, asking for the what? For the allowances to be paid to the what? To the staff who didn't what? Who didn't receive the what? The risk allowance. But all we did, nothing was done what? So we were left unpaid. Yes, up to now.
Did you try to compare with your colleagues in other facilities?
Yes, other facilities, they were telling me they received what? Their salary, their risk allowances. Others, they have not yet done what? Received.
What on the side of the health workers?
Now on the side of the health workers, they are now demoralized. And as per now, we have that pandemic which has done what? Which has hit our what? Our region, the Ebola. And whenever you tell them, please, you come and we do what? We help. They say, no, let them first give us our what? COVID money. Because we still will do what? Demand. And the worst thing of it, they said now, all people who are on the list that you sign, that you are the right what? Person. People signed. And now they were blaming me that after signing, I was given money and I didn't do what? Pay them. Which is not true.
How many people and how much money are we talking about altogether?
In fact, I can't, I've forgotten, I can't give you the actual what, but...
Because there are people who cross-check. You see that you have done the right thing, then you move inside. When you're inside and you're not feeling could exit, don't insist. Because your number one duty is to make sure that you stay alive. But you also give life to people who are sick. And imagine, we value health workers. Right now, you people know that our health workers had contact. We don't want any more health workers having contact. Not you. So there is no room for mistakes. Repeat again. There is no room for mistakes. Now even the devil has not come. So if you just talk like that, you have to scare them. Talk with confidence. There is no room for mistakes.
There is no room for mistakes.
And repeat it always. When you're going inside there, you repeat it. Repeat it to yourself every morning that you cannot afford to make any mistake. Follow the procedures to the dot. And then go in there and take care of lives and come out. Another very important thing, please cancel one another. Make friends with one another. Don't live your life in isolation. You get what I'm saying? Yes, everybody needs counseling. The patients in there need counseling. Don't you counsel them? So who is counseling you? Because you're going in there. So counsel one another, make friends, check on me. Chena Cheng, are you okay today? How did you sleep? Are you good? Talk to another one. Grace, how do you feel today? I know you can talk through whatever. And even when you come out, talk with one another, counsel one another. We are going to get over this. We are going to do it. Reassure one another. It is very important. Because once you get your accommodation and in your area, for us, we can only talk to you from outside. You are here. Even when the cases are over, we are counting 42 days, we are also isolating you. You know that? Yes, so talk to one another. If you want to talk to us, also call and talk to us. Say, we want to hear your voice today, and we shall talk to you. Extremely important. So are the soldiers ready?
Yes.
Are you ready?
Yes, we are ready.
You know, if I was the army, I would say, soldiers! And then you show me if you are ready. Are you ready? Yes. Soldiers! Thank you very much. You are in our prayers every day. And thank you for committing to serve. You are serving your nation, your country, and your children. Because anybody there can be anybody's relative.